Quick video about one of my favourite breathing techniques. It's golden ribbon breathing is what I call it. My teacher, Uma Dinsmore-Tooley, calls it golden thread breathing, and also I think it's known in as quite a useful birthing breath as well. Really great for pregnancy and labour. I teach it all the time in my pregnancy classes. I also teach it for fertility students or anyone really that wants to find a little bit of calm and ease. It can be really useful in a number of different situations. One of my favourites. So initially just finding a comfortable seat somewhere. I'm sitting on a bolster on the floor in a kind of meditation pose, but you could sit on a chair, you could sit against the wall, you could lie down to do this. But if you think you're tired and might fall asleep, then maybe a seated position might be better. You could do it in a nice seated restorative pose as well, like supported reclining pose. That would be really nice. So wherever you've chosen to sit, I'm going to bring my sit bones out a little bit, just taking a moment to really find the ground and to open up into the space around you. So have a sense of the boundary of the body and letting the body just expand and open, giving permission to ground. And release the day. And as you begin to arrive and settle in, just taking a moment to really become aware of your breath. So you could just have a soft gaze in the eyes, or you might want to close the eyes and bring the attention in and down. Just really becoming aware of your breathing. Not trying to change the breath in any way, but just watching the breath coming in and the breath coming out. And then just becoming aware of this 4-part breath, this inhalation pause that turns into exhalation pause. And really just becoming aware of the pauses in the breath and letting yourself just rest in those pauses. And when that breathing rhythm is nice and established, we're going to change that a little and breathe in through the nose and out through gently parted lips, as if there is a leaf, piece of paper, or I like to think of it as a nice ribbon spinning out through gently parted lips. In through the nose and out through gently parted lips. Small, small space. Imagine a silky ribbon or thread. Spinning out away from you, and then feeling that little pause at the end of that before that in-breath comes in again. In through the nose and out through gently parted lips. You might also feel at the end of that exhalation a kind of connection to a dropping down and an opening up sensation in the base of the body, because the mouth and the pelvic floor are connected. Which is why this breath is so useful for labour, because when this is soft, then all of this is soft. And open. But when we extend the exhalation in this way, it's really soporific as well and really grounding. So great for times of stress, transition, seasonal change. Enjoy.